Welcome to The Growing Dentist by Dr. Ali. Before we start, kindly like, share, and subscribe to our channel for more upcoming videos. In this video we will talk about teeth flossing. Dental floss is a special strong thread, which is used to take out food particles trapped between the teeth. Floss as we know it today, was developed around 200 years ago. The invention of floss has been credited to Levi Spear Palmley, a New Orleans-based dentist, in the early 1800s. Dr. Palmley wanted to find a way to remove pesky pieces of food, in places where a toothbrush could not reach, knowing food particles lead to gum irritation or disease. Dental floss is commonly made out of one of two polymers, which are synthetic compounds, either nylon or Teflon. Nylon is defined as a fiber-forming substance of a long-chain synthetic polyamide. A polyamide is a compound characterized by more than one amide group. An amide is a chemical related to ammonia. Different types of dental floss are unwaxed floss. This thin, simple floss is the most common type you'll find in stores. Waxed floss. If unwaxed floss isn't working for you, you might prefer using the waxed kind instead. Dental tape. Super floss. Polytetrafluoroethylene floss. Coming out of the gate strong, this floss is the boss with effortless gliding between evenly spaced teeth. The wax also strengthens the floss and prevents it from fraying too easily. Water flosses have been around for years, but are only recently gaining popularity with patients, dentists, and dental hygienists. Although known for being a little messy at first, shifting to water flossing can have tremendous long-term benefits on your oral health. If you constantly struggle with flossing, or don't do it as often as you should, investing in a new water flosser is a great solution. Normal threads have a rough texture that may harm the gums if flossing is not done carefully. Besides, normal threads can break easily and get stuck in between the teeth. Instead, use dental floss that is specifically made for flossing purposes and is gum-friendly. Dental floss is a cord of thin filaments, used in interdental cleaning to remove food and dental plaque from between teeth, or places where toothbrush has difficulty reaching, or is unable to reach. Its regular use as part of oral cleaning is designed to maintain oral health. But even the best toothbrush can't fully cleanse the spaces between your teeth. That's why the American Dental Association recommends you floss once a day to remove food particles and plaque, the sticky film on your teeth that can lead to cavities and gum disease. Scientifically speaking, it helps remove interproximal dental plaque. It is the plaque that collects between teeth. It also helps remove debris, such as food particles that can cause bacteria if not removed. Flossing not only helps prevent a number of dental issues, but can also relieve toothache. Why do gums bleed when flossing? The most common reason for gum bleeding can be a buildup of plaque or tartar. Both of these substances can allow bacteria to form along your gum line and cause sensitivity and bleeding when flossing. Other common causes of bleeding gums can include not brushing your teeth enough. You may discover tooth sensitivity while flossing, or even when you consume hot or cold beverages or foods. Regardless of how you discover the sensitivity, it occurs because too much of your tooth enamel has worn off and left your nerves exposed. A good dentist can help you fix this issue. We will now look into how to floss. Lightly wrap each side of the piece of floss several times around each middle finger. Next, carefully move the floss in between the teeth with your index fingers and thumbs in an up and down motion, rather than side to side. Bring the floss up and down, making sure to go below the gum line. Repeat the steps as you move from tooth to tooth. Take complete advantage of the pliability and thin structure of floss by allowing it to ascend 2 to 3 mm below your gum line. This helps to remove bacteria that could contribute to gum disease and compromise your tooth health. Your teeth are too close together, and plaque built up in between your teeth traps the floss, or restorations, such as crown and filling, that has started to break down, which makes the surfaces between your teeth uneven, leading to improper flossing. To prevent plaque buildup and gum disease, you need to floss daily, at least once a day. If you were rushing to brush your teeth after an earlier meal, Flossing during your next brush allows you to remove the hard-to-reach plaque, bacteria and food particles. The American Dental Association recommends that you brush your teeth twice daily and floss each day. While we know of some patients who floss after each meal just to ensure there's no food stuck in their teeth, flossing just once each day will work wonders for your oral hygiene. If daily flossing takes you less than 30 seconds to do your entire mouth, you should slow down and go for accuracy. If it takes you 90 seconds, you are fighting off gum disease and decay. And if it takes you 2 to 3 minutes, you deserve a gold star. However, the floss may lose its potential cleaning efficiency after a single use, and it may redeposit the bacteria back in the mouth. In light of this, it is advisable to use a piece of floss only once. It's true not everyone can floss. Dental work such as orthodontic braces, fixed lingual wires and bridges can limit an individual from using regular string floss. But where there is a will, there is a way. Other ways to clean between your teeth and under the gums include superfloss and dental pixters. Healthy teeth and gums need a regular dental checkup. Red or swollen gums that bleed easily can be a clear sign that flossing and better dental habits are needed. Cleaning all sides of your teeth, including between your teeth where the toothbrush can't reach, is a good thing. Be thorough, but gentle when using dental floss. Make sure to reach the gum line, but don't force it down too far or too severely, as this can damage your gums. Always follow flossing advice given to you by your dentist. This includes how often you should use it. For any questions or advice, please write down to us. The Growing Dentist team is always there to help you out. Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.